Right, I'm going to be finding and correcting for a category of 1 pelvis. I'm going to begin this by establishing a good indicator muscle. I'm going to use the hamstrings for a muscle test. Go ahead and bring the knee up. Go ahead and resist. Good, we have a strong muscle. So go ahead and touch your wrist right here. I'm going to now do a muscle test with the sedation point. Go ahead and resist. Good, made it go weak, so we have a good indicator muscle. I'm now going to perform a muscle test with therapy localization at the SI. So go ahead, place your hand on your pelvis. Now I'm going to do a muscle test here. Right, we have a weak muscle, so this is indicative of a category 1 pelvis. So I'm now going to check the, and you can remove your hand. I'm going to check the ribs for tenderness. Good, are either of those sides tender? We have tender ribs. So this further indicates that we have a category 1 pelvis. So I'm now going to go ahead and establish priority for the sides. Go ahead and place both hands on this SI over here. I'm going to do a muscle test. Good, we have a strong muscle. I'm going to go ahead and do it on the other side. We have a weak muscle on this side, so my priority is going to be on the right side. I'm going to save that for later. Now I'm going to do a rebound challenge on the PSISs and on the ischial tuberosities. So I'm going to go on right PSIS, left isch2. Perform a muscle test. Then resist. Go with a strong muscle. So now I'll do it on the other side. Do a muscle test and resist. I have a weak muscle, so now I'm going to place the blocks opposite of where I had my weak muscle. I want to make sure that the blocks are angled down. I'm going to ask him if he has any problems with his knees. Do you have any problems with your knees? No, he's good. Now I'm going to check the ribs again. And now we have no tenderness on the ribs. Now I'm going to pump on the opposite side of the priority. So my priority was on the right side. I want to stay clear of the block, so I'm going to do on the PSIS on this side. And I'm going to pump it 10 times. 1, 2, 10. Right. Now I'm going to check the ribs again. Now they're in the clear. If they weren't in the clear here, then we would have a potentially subluxated rib. So now to make sure that I've corrected my category 1 pelvis, I'm going to have him place his hands on his SI joints and perform a muscle test, and we should be strong. Go ahead and resist. Good, we have a strong muscle. So now I'm going to remove the blocks. Perform another muscle test. Go ahead and hold. We have a strong muscle. I have corrected my category 1 pelvis. So after fixing a category 1 pelvis, I'm now going to analyze and assess for a category 2. I'm going to do a muscle test, therapy localization on the SI joint. So go ahead and therapy localize on this side. Perform a muscle test. Strong, go ahead and therapy localize on this side. Perform a muscle test. Weak, so now I know that the right side is my priority. So now I have him flip over and establish a good indicator muscle. I'm going to use rectus femoris. Go and bring his leg up. Test with a strong muscle. So now go ahead and therapy localize the sedation point for rectus femoris on the side of the elbow. Now I have a weak muscle, so now go ahead and push your hands to your side and perform the muscle test one more time. And now we have a strong muscle, so I've established a good indicator muscle. Now I'm going to do a rebound challenge on the PSIS on the right side. I'm going to come up, perform a muscle test. We have a weak muscle, so now I'm going to do the isch2. And we have a strong muscle. So now I know that the PSIS is going to be the priority for this case. I'm going to block under the PSIS on this right side. I'm going to keep it there for about 5 breaths. After 5 breaths, I'm now going to perform another muscle test with therapy localization at the PSIS. So go ahead and place your finger right here. Go ahead and resist. Have a strong muscle. Now I'm going to remove the block. Having therapy localized still, perform the muscle test, hold, and have a strong muscle. This was category 2 SI. I'm now going to analyze and assess for a category 2 SP. I'm going to first establish a good indicator muscle. I'm going to use sartorius on this side. Go ahead and bring his leg in. I want you to try to pull your opposite pocket. Go ahead and resist me on 3. 1, 2, 3. Good, we have a strong muscle. So now I'm going to have him press in the center of his wrist, right here. Perform the same muscle test. And it's weak now. So go ahead and let go. Perform the muscle test one more time. Good, strong. So I've established a good indicator muscle. I'm now going to analyze for the category 2 SP. So go ahead and therapy localize on the umbilicus down, on the symphysis pubis. Perform the muscle test. And we have a weak muscle here. So we have a category 2 SP. I'm now going to perform a rebound challenge on the opposite PSIS and ischial tuberosities. Perform a muscle test. It's weak. Perform a muscle test. And it's strong. So I now know that I'm going to need the block on the PSIS on the right side and the isch tube on the left side. Go ahead and get up. PSIS. Isch tube. And those are going to be going 90 to the spine. I'm now going to perform the short leg, long leg routine. Going to go lateral, superior, medial on the high block, and medial, superior, lateral on the low block. So lateral, superior, medial, lateral, superior, medial. We're just trying to induce some more motion at the pelvis. Medial, superior, lateral, medial, superior, lateral. We want the block to stay in there. I'm now going to do a therapy localization with the blocks on the symphysis pubis. So go ahead and place your hand back there. Sartorius, go ahead and resist. A strong muscle. Now I'm going to remove the blocks. Normal muscle test with the therapy localization. Go ahead and resist. We have a strong muscle there. That's our category 2 SP. I'm now going to analyze and correct for a category 3 pelvis. I would initially start this by establishing a good indicator via the sedation points. I'm going to assume that I do have a good indicator muscle at the hamstrings for the sake of time. So now I'm going to begin this analyzation by torquing the spinous at L5 and the ilium on opposite sides into the same direction. So I'm going to L5 spinous, ilium here, and I'm going to torque. And I'll perform a muscle test. Go ahead and resist. So I have a weak muscle. Now I'm going to do it on the other sides, L5 and ilium, torque. And I have a strong muscle here. So now I'm going to place the blocks on the same sides where I weight weak, ASIS and the trochanter. So the ASIS on this side. Trochanter on this side. Now I'm going to check L5 and move the blocks, making sure that it's not tender. So I'll move it here, still a little tender. Move it there, still a little tender. And I get you right here. I now have no tenderness at L5. Now I'm going to check for sacral faults. I'm going to perform the muscle test while he's inhaling and exhaling. So go ahead and take a deep breath in. Perform the muscle test, strong, take a deep breath out. And now it's weak. So now what I'm going to do is go to the sacral apex, and I'm going to press down 4 to 5 times with 4 to 5 pounds of pressure on inhalation, since it went strong on inhalation. Now I'm going to perform the muscle test on inhalation and exhalation again. Go ahead and breathe in. Perform the muscle test, strong. Go ahead and breathe out. Perform the muscle test, also strong. I'm now going to see if my category 3 pelvis is clear. So I'm going to do a rebound challenge with the blocks in on the same side where I initially had my issue. So L5 and ilium. Strong. And now I'm going to do a rebound without the blocks. And strong. I've cleared the category 3 pelvis. I'm going to be going over how to assess for the 12 cranial faults. I would initially start this by establishing a good indicator muscle. I'm going to do the pec wave. I have a good indicator muscle at the pec. The first thing I'm going to do is do a rebound challenge, P to A, on the mastoid. And this would be inhalation. I would check the muscle, and if it were a cranial fault here, it would be weak. I'm now going to go A to P on the mastoid during exhalation. Same thing, do the muscle test. If it's weak, I would have a cranial fault here. I'm now going to go P to A on mastoid and I to S on the palate simultaneously. If I do my muscle test here and it was weak, I would indicate a spinobasilar inhalation assist. I'm now going to go A to P on mastoid, hook under the maxilla, and do my muscle test. If it was weak here, I would have spinobasilar exhalation assist. I'm now going to go on the EOP with one finger, and the glabella with one finger. Do my muscle test. If it was weak here, I would have a glabella cranial fault. I'm now going to go on the frontal bone and occipital bone. Squeeze and twist. Squeeze and twist forward. Squeeze and twist back. Muscle test. Weak here, I have a temporal bulge cranial fault. Now I'm going to check now I'm going to go on the cheek. Muscle test. If it's weak here, I have an internal frontal cranial fault. I'm now going to go on the lip, compressing in at the incisor. And if it's weak here, I would have an external cranial fault. Now I'm going to go next to the eye and towards the glabella. If it was weak here, I would have a nasosphenoid cranial fault. And now I'm going to go underneath the occiput and twist. And if it was weak here, I would have a universal cranial fault. I'm going to be going over how to treat cranials right now. We're going to start with inhalation. So to treat inhalation, I'm going to start by pushing P to A on the mastoid. I would then check the muscle. It should check weak here. So in order to treat this, what I'm going to do is I'm going to press on the mastoid P to A 4 to 5 times with 4 to 5 pounds of pressure on inhalation. So I would do that while he breathes in. Go ahead and breathe in. After 4 to 5 times, I will recheck my muscle, pressing P to A. Check, and it should be strong. For exhalation, I'm going to press A to P on the mastoid. Check my muscle. It should be weak here. So now I'm going to press 4 to 5 times with 4 to 5 pounds of pressure. A to P on the mastoid during exhalation. So I have him breathe in. And then I would do that 4 to 5 times, 4 to 5 pounds of pressure. I now recheck A to P. It should test strong. I'm now going to correct for a spinobasilar cranial fault on inspiration. I'm going to start by pushing P to A on mastoid, I to S on palate, check my muscle. It should check weak here. I'm now going to treat on forced inhalation. So what I'm going to have him do is take a deep breath in, and then a little bit more, And during that a little bit more, I'm going to press P to A on the mastoid and I to S on the palate, and then I would have him breathe out. And then I would do that same process 4 to 5 more times, and then I would check P to A on mastoid, I to S on palate, and the muscle should test in the clear. I'm now going to do sphenobasilar cranial fault on expiration. For this one, it's A to P on the mastoid while I hook onto the maxilla. Check the muscle, should check in the weak here. I'm now going to treat on forced exhalation. So I would have the patient breathe in, then breathe out, and finish a little bit more. And then here, I would go A to P on the mastoid, and I'd hook onto the maxilla, treating, and then I would have him repeat that process 3 to 4 more times, and then I would rebound check one more time, A to P on the mastoid, hook onto the maxilla, recheck my muscle, and it should test in the clear. I'm now going to correct for the glabella cranial fault. I'm going to start by going onto the EOP and the glabella, going to press, check. It should be weak here. I'm now going to check for inspiration on the mouth and on the nose. So what I'm going to have him do is take a deep breath in on the mouth, or in on his nose. Takes a deep breath in, press down on the EOP and glabella, check. That made it go weak. I'm now going to do it on with the mouth, so I have him occlude his nose. EOP and glabella, go ahead and take a deep breath in, press, check my muscle, it stayed strong there. So I'm now going to treat that phase of inspiration 4 to 5 times with 4 to 5 pounds of pressure. So I go into the EOP, glabella, have him occlude his nose, breathe out through, or breathe in his mouth. And while I'm on the EOP back here, I'm also going to be on C1, C2, and C3. And as he breathes it in, I'm going to press up and down on the EOP. And then I would do this 4 to 5 more times, and I'm applying 4 to 5 pounds of pressure. I would then have him take his hand off his nose, check EOP and glabella. We should test in the clear here. We're now going to continue with cranial faults. We're going to start at the temporal bulge. So I'm going to, I would test both sides, but for demonstrational purposes, I'm only going to do one. I'm going to start at the occiput and the frontal bone. I'm going to approximate them, and I'm going to check, and that makes it go weak. I'm now going to do it while twisting forward, check, strong, twist back, and that makes it go strong as well. So I'm going to treat in the one that made it go weak, which is the approximation. I'm going to do it on a half-held inhalation, so I'm going to check the inspiratory volume, so go ahead and breathe in, breathe out. All right, I now know about how much volume he has in his breath. So I'm now going to have him inhale, halfway and stop, and I'm going to squeeze for 4 to 5 seconds, then release, then have him resume normal breath, and then I would do that again 3 to 4 more times, and then now I'm going to perform my rebound challenge, check, and now my muscle is in the strong. I'm now going to do parietal scent. I'm going to flick the parietal ridge, do my muscle test. Pec wave is weak. Now going to treat on half-held expiration. So I've checked his volume already. I know where he is. So I'm going to have him inhale, then exhale, halfway stop, and I'm going to twist 4 to 5 seconds, and then release. I have him resume normal breath, and then I would do that 3 to 4 more times. And now, after he's done it 3 to 4 more times, I would do my rebound check again. Check, pec wave, and now it's in the strong. I'm now going to do internal frontal cranial fault. So I'm going to rebound on the cheek here, check my muscle, and it's weak. So I'm now going to simulate as if I was going on the outside of the mouth, because I'm going to would be doing all the treatment on the inside of the mouth. I'm going to go ipsy ipsy contra, 30 seconds I to S on the palate, 30 seconds S to I on the pterygoid, ipsy here, and then 30 seconds I to S on the contra pterygoid over here. I would then do my rebound challenge once again on the cheek, test the muscle, and it should be in the strong. I'm now going to do external frontal cranial fault. So I'm going to do my S to I rebound test on the lateral incisor, go down, do my pec wave check, and it's weak. So I'm going to go I to S on the palate on the contra side. So I checked the contra, or this side over here. So I'm going to go I to S on palate for 30 seconds. And then I to S on pterygoid over here for 30 seconds. And then now I'll recheck my tooth, S to I, pec wave, and we're now in the clear. I'm now going to correct for nasosphenoid cranial fault. I'm going to rebound, check, and we're in the weak here. So I'm now going to rebound, then have him inhale, check, and that was strong. So I will rebound once again, have him exhale, check, and that went weak. So I'm going to treat the one that made it go better, which was during inhalation. So I'm going to have him breathe in, and then I would press 4 to 5 times, 4 to 5 pounds of pressure. And then I will do my rebound check now, press, test my muscle, and we're in the clear. I'm now going to treat for universal cranial fault. I'm going to palm the occiput, going to twist clockwise, check my muscle, twist counterclockwise, check my muscle, and on clockwise rotation, that made it go weak. So I'm now going to determine which nostril I need to use. So I'm going to treat the weak side, so I would twist, and I would have him cover the right nostril. And take a breath in and out, check, that made it go strong. So now I'm going to include the left nostril, breathe in and out, and then I would check my muscle, that made it go weak. So since the right side made it go weak, I would have him occlude that nostril. And since clockwise rotation made it weak, I would go counterclockwise rotation, which made it strong. And I would have him breathe in and out 4 to 5 times, 4 to 5 pounds of pressure. And then I would have him relax, go back down. And now I'm going to test clockwise rotation because that made it go weak. Check my muscle, and we're in the clear. Now to treat sutures, I'm going to use the sagittal suture just as my example here. I'm going to start by pressing in on the sutures, check, that makes it go strong. I'm now going to pull them apart, check, that makes it go weak, so I need to treat while pulling apart on the sutures. I'm now going to check with inhalation, so I would pull apart, have him breathe in, then check, and then I would pull apart, have him breathe out, check. Whichever phase made it go strong would be the one that I treat. So we'll say that exhalation made it go strong. So while pulling apart and with exhalation, I'm going to have him breathe in and out 4 to 5 times. And as he is breathing out, I'm going to pull the sutures apart for 4 to 5 seconds. Then I'll have him breathe in, and then out, pull apart, 4 to 5 seconds, and then I would repeat that a few more times. I would then now rebound by pulling apart, retest, and it should be in the clear.